How to diagnose UTI? Clinical symptoms with medical and surgical history is the most important to diagnose UTI. Investigations or lab tests to diagnose UTI. Urine test, urine dipsticks, urine microscopy and cytometry, urine culture to know microorganisms. For these tests, patient is asked to collect clean catch urine by washing and wiping genital area and midstream urine sample in a sterile container so that bacteria around the genital area cannot come into the urine sample and will prevent the confusion of test results. Blood test for complete blood count, urea and electrolytes in infants, children, and patients with fever or any complicated infection, and blood culture. Imaging tests to diagnose UTI are USG or ultrasonography. Ultrasound uses a device called a transducer that bounces safe, painless sound waves of organ to create an image of their structure. CT scan. CT scans use a combination of X-rays and computer technology to create three-dimensional images. MRI, magnetic resonance imaging. MRI machines use radio waves and magnets to produce detailed pictures of the body's internal organs and soft tissues without using X-rays. Radionuclide scan. A radionuclide scan is an imaging technique that relies on the detection of small amounts of radiation after injection of radioactive chemicals. Special cameras and computers are used to create images of the radioactive chemicals as they pass through the kidneys. Urodynamics. Urodynamic testing is any procedure that looks at how well the bladder, sphincters, and urethra are storing and releasing urine. Most of these tests are performed in the office of an urologist, means a doctor who specializes in urinary problems, by a urologist, physician assistant, or nurse practitioner. Some procedures may require light sedation to keep a person calm. Cystoscopy, looking inside the bladder and urethra with a camera lens inserted via the urethra through a long thin tube. Pelvic examination in women and rectal examination in men. Investigations to diagnose UTI depends upon age, gender, clinical symptoms, and severity of infections. This use selectively. For more updates on healthy lifestyle and medical problems, visit www.askmeforadvice.com. Thank you for watching. Do not forget to like and subscribe.